Hello. A peptic ulcer is a break in the inner lining of your stomach, or duodenum, which is the first part of your small intestine. If this causes you to have symptoms, it's known as peptic ulcer disease. Peptic ulcers are most commonly caused by bacteria or a type of medication. 2 decades ago, nearly all peptic ulcer disease was due to a bacteria called Helicobacter pylori. But nowadays, as general hygiene has improved, bacteria causing peptic ulcer disease has become less common, but does still occur. Non-steroidal anti-inflammatory drugs such as ibuprofen, aspirin and naproxen are commonly used as painkillers or to prevent future heart attacks. Prolonged use of these medications can cause peptic ulcer disease. Around 7 out of every 10 people with a peptic ulcer have no symptoms. The rest may suffer from heartburn, tummy pain, nausea, or excessive belching. You should book an appointment with your GP if you think you may have peptic ulcer disease. They may arrange some investigations to test if you have Helicobacter pylori in your stomach. If your GP is unsure about your diagnosis, they may refer you to have a gastroscopy. This involves passing a thin black tube with a tiny camera on the end into your mouth and down into your stomach and small bowel to look for an ulcer. If you're found to have Helicobacter pylori in your stomach, your GP will prescribe you a course of antibiotics and a medication called a proton pump inhibitor. Proton pump inhibitors reduce the acidity of your stomach and help ulcers to heal. Examples include omeprazole and lansoprazole. Your GP may also recommend you stop taking non-steroidal anti-inflammatory drugs. If you cannot stop, your GP may prescribe a proton pump inhibitor to protect your stomach. Over-the-counter medications are also available, for example, Gaviscon or Reni tablets. These are anti-acid medications, but only provide short-term relief. Peptic ulcer disease is important to treat as it may lead to serious complications such as bleeding or perforation. Bleeding from an ulcer causes a person to vomit blood and turns their stools black and sticky. A perforation is when the ulcer creates a hole in your stomach. This can give you severe tummy pain and make you very unwell. If you think you or someone you know is developing any of these complications, please seek immediate medical attention by calling NHS 111 or visiting your nearest emergency department. If you have any questions about peptic ulcer disease, please speak to your GP.